Welcome back at 7:15. World Parkinson's Day is next week, and despite years of research, Parkinson's still remains a lot remains unknown about the condition that's impacted so many lives. Joining us is Franny Bienvenue, an OT clinical specialist with Touro LCMC Health, to talk about Parkinson's. Good morning, Franny. Thanks for being with us.
Well, good morning. Thanks for having me.
So I think lots of people think they know what Parkinson's is, or they think they're familiar with it. But for those who might still not quite understand, explain what Parkinson's is exactly.
Well, Parkinson's is a neuroprogressive disease. Symptoms worsen over time. It's a movement disorder, and it can affect your daily functional skills, and it can affect your mobility skills and just how you perform in your daily life.
Franny, I think most people are familiar, if they are familiar with Parkinson's, are familiar with the tremors that are associated with it. But what are some other symptoms that someone who's suffering from this disease might also be dealing with?
Yes, that's a great question. I mean, not only the tremors, which are what most people kind of tend to think about, you can also see like a stiffness of movement, a stooped posture. You may notice some decreased balance or coordination. Also the voice. You may notice like more of a lowness of voice.
Because it affects your vocal cords too, is that what's happening?
Well, it's also a perception of how the person feels that they're speaking or feels that they're moving. It's much smaller or lower than they tend to feel that it really is.
Is there anything that can be done as far as early detection is concerned, and why would early detection be so important with this disease?
Yes, you can definitely detect early. In fact, oftentimes I find that family members or friends will notice the symptoms even more than the person themselves, because part of Parkinson's is that a person is not aware that they're moving slower or that they have a stooped posture or that their voice is lower. So it's important for family members to be attentive to that and to kind of encourage the patient or the person to be able to seek some medical help.
Because there are lots of treatment options out there now and lots of therapies. You and I were just talking about a story we ran yesterday. I believe it's in Arizona, where there is a ballet therapy for Parkinson's patients. And you said something similar is available in our area.
Well, there is. And in fact, one of the exercise programs we do at Touro is the LSVT Big and the LSVT Loud, and focuses like on exercise. And basically what it is those programs focus on amplitude of movement and focus on that amplitude of voice or that loudness of voice, which is so important because an exercise program really can help to kind of slow the progression of the symptoms that you may find with Parkinson's disease.
And something like a dance therapy where there's also music, why would that also be something that's helpful for someone with Parkinson's?
Well, that is very helpful too, because it also helps to stimulate the brain. Just like exercise stimulates the brain, so does music and so does dance. And what we find is just what all these programs can do is to be able to help to kind of improve that or to retrain that sensory, those motor and those cognitive components.
That you're starting to lose, right?
Yes, yes.
Now, Franny, we have a few seconds left over. Again, you mentioned usually it's the loved one, a friend, a coworker who's noticing the symptoms in somebody. So if there's something that you're recognizing in a loved one, or even if you are recognizing it in yourself, how can they contact Touro for more assistance with diagnosis and possible treatment if that's what's happening, if Parkinson's is in fact something that someone's suffering with?
Definitely. Well, there's a couple of things you need to do. You would actually need to get a referral from your physician. So you do need to get a prescription from your doctor. And that if you want to just check out for our information, just look on Touro's website and you can get our contact information there.
All right, Franny, thank you so much for being with us. We appreciate your time this morning.
All right, appreciate it.